10 early warning signs of colon cancer you should not ignore. Are you aware that colon cancer is often called the silent killer? This is because there may be no symptoms until the tumor has grown large enough to cause problems. In fact, over 100,000 new cases of colon cancer are reported each year in the United States alone, making it the third most common cancer in both men and women. Shockingly, nearly 50,000 deaths each year are attributed to this disease. Colon cancer is a condition where cells in the large intestine become abnormal and multiply uncontrollably. We can't be certain if someone will develop colon cancer, but there are some early warning signs that may indicate a problem. That's why it's crucial to recognize the warning signs that your body might be giving you. Some of the signs mentioned may be subtle, while others may be more obvious. So, grab a pen and paper, take notes, and let's dive in. By the end of this video, you'll have a better understanding of what to look out for and how to take action if you suspect something might be wrong. Number 1. Constipation. Constipation occurs when the colon becomes clogged and is unable to function correctly. It can be caused by various factors, including a lack of physical activity, certain medications, and a diet low in fiber. Mild cases can often be resolved by improving fiber intake, but constipation can be an early sign of colon cancer. In fact, more than 80% of patients diagnosed with colon cancer had experienced constipation before their diagnosis. If constipation persists for more than 3 days or is accompanied by other symptoms such as abdominal pain and bloody stools, it's crucial to seek a doctor. It can be challenging to differentiate between normal constipation and colon cancer, so seeking medical attention is essential. Number 2. Fatigue. Feeling tired is a common experience, but if you find yourself persistently fatigued, it could be a subtle warning sign that something is not right in your body. For example, chronic fatigue could be an indication that your body is struggling to fight a cancerous tumor, particularly one in the colon. Colon cancer symptoms often develop slowly, making it difficult to detect early warning signs. However, if you experience persistent fatigue, bloating, or abdominal pain, it could be an early indication of colon cancer. Waste removal slowing down in the colon can cause toxic buildup, which may eventually lead to cancerous tumors in the colon wall. Such tumors can cause blood loss through the stool, resulting in iron deficiency that leads to fatigue. Number 3. Bloating and abdominal pain. Bloating, which is a feeling of fullness or swelling in the abdomen, is a common symptom of colon cancer. However, it can also be caused by other factors like gas, certain foods, or medications. If you experience bloating after meals, it's recommended to eat smaller meals more frequently instead of 3 large ones. This can help prevent bloating caused by overeating and maintain stable blood sugar levels. Abdominal pain is another common issue that can have various causes, including certain foods. While some discomfort is normal, it's critical to be aware when the pain becomes frequent and persistent. By recognizing these symptoms and taking action, you can reduce your risk of potential health issues like colon cancer. Number 4. Sudden weight loss. Sudden weight loss can be a sign of colon cancer, as well as other gastrointestinal diseases. It's important to keep track of how much food you're eating, and if you're still losing weight despite eating regularly, you should get yourself tested. The symptoms of colon cancer differ based on the location and stage of the tumor. If you have lost more than 10 or 15 pounds over several months, it could be a sign of colon cancer. However, sudden weight loss can also occur for other reasons, notably if you're an older adult and have overcome an illness. It's completely normal to have shed some extra pounds. But if you are experiencing a sudden drop in weight along with any other symptoms, you need to get a thorough checkup. Cancerous tumors can cause problems in the way your body functions, including stopping your body from absorbing all the nutrients and using the food you eat in the normal way. As a result, you might not be getting enough energy, causing your body to use its reserves and leading to weight loss, which could be a big giveaway that something is wrong with your body. Number 5. More or fewer bathroom trips. Colon cancer is most commonly diagnosed in people around 60 years old, but younger people can still get it. In fact, half of the people diagnosed with colon cancer are over 65 years old. One of the earliest signs of colon cancer is a change in bowel habits. A healthy colon should have regular bowel movements every day or two, with soft, brown stools that are easy to pass and show no signs of blood. It's important to pay attention if you experience any changes in your bathroom habits, such as going more or less frequently than usual, or having stools that are hard and difficult to pass. If you notice any of these changes, it's recommended that you see a doctor for an evaluation, as it could be a sign of an underlying health issue that requires attention. Number 6. Blood in your stool. Losing blood through stool can be an early sign of colon cancer, as colon tumors can cause bleeding. However, you may not always see blood in your stool, which is why it's critical to watch for other signs. If you're experiencing fatigue, weakness, or shortness of breath, you may have anemia, which can result from a decrease in red blood cells caused by bleeding from colon cancer cells. Anemia can be detected through a routine blood test and is a reason to get checked for colon cancer. Colon cancer is one of the most treatable cancers if detected early, with a 95% 5-year survival rate. However, 1 in 20 Americans will develop colon cancer during their lifetime, so it's important to stay vigilant. Bloody stools can be caused by many different types of cancer and other conditions, such as ulcerative colitis, diverticulitis, hemorrhoids, or inflammation or injury in the large intestine. Certain medications, like antibiotics, antidiarrheal drugs, or iron supplements, can also cause bloody stools. Early detection and treatment of colon cancer can greatly increase your chances of survival. Number 7. Diarrhea. Experiencing loose or watery bowel movements is a frequent issue among those with colon cancer. Diarrhea is defined as passing 3 or more unformed stools within a 24-hour period. However, it is not an exclusive symptom of colon cancer and can also be caused by other conditions such as irritable bowel syndrome, lactose intolerance, or inflammatory bowel disease. According to the National Cancer Institute, some individuals may develop diarrhea due to parasitic or bacterial infections in their colon. Number 8. Narrow stool. Checking the shape and size of your stool regularly is essential to detect any potential signs of colon cancer. If you notice that your stool is thinner than usual, or if you experience changes in your bowel movements, such as chronic constipation, it's important to speak with your doctor. It's better to be proactive about your health and discuss any irregularities with your doctor, as they can determine the appropriate tests needed for a proper diagnosis. Remember, catching cancer early gives you the best chance for successful treatment. Don't be scared, be aware and take control of your health. Number 9. Nausea. Nausea can be a symptom of colon cancer when the tumor blocks or partially obstructs the colon. This blockage can lead to a backup of waste in the digestive system, causing discomfort and nausea. Additionally, colon cancer can sometimes spread to other parts of the body, such as the liver, which can also cause nausea. It's important to note, however, that nausea is not always a symptom of colon cancer and can be caused by many other conditions as well. That's why it's important to see a doctor if you're experiencing nausea or any other unusual symptoms. Number 10. Rectal bleeding. It's crucial to pay attention to your stool and any bleeding you may notice, as it could be a sign of colon cancer. The blood's color can provide clues about where the bleeding is coming from. Bright red blood typically indicates an issue in the lower digestive tract, while dark maroon blood suggests a problem in the upper digestive tract. Rectal bleeding can also be caused by other conditions such as hemorrhoids or anal fissures. However, if you experience rectal bleeding in larger amounts than usual or if it's a recurring issue, you should consult your doctor to rule out the possibility of colon cancer. It's important to note that colon cancer can be caught early if you regularly check for signs like rectal bleeding and seek medical attention as soon as possible. Thanks for watching. If you enjoyed this video, we have 2 more that we think you'll really love. Just tap on the links to check them out. And while you're there, don't forget to hit that subscribe button to stay up to date with our latest content. Thanks for your support, and we'll see you in the next one.